everybody. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner. Today, I have with me a magnificent clinician, hygienist, Barbara Tritz. Barbara, thank you so much for being on the show today.
Oh, thank you for the invitation. I am excited to share my passion with your listeners.
The things that Barbara is doing, you guys, are things that hygienists have always talked about, dreamed about, bringing the full body and all of the ways that it heals itself, or like there's a dysregulation in the body, to your operatory and to and the patient's life, right, Barbara? So before we get started, Barbara, why dental hygiene for you? Like, what drew you to it?
Oh, I wanted to be in healthcare from the time I was 5 years old. My poor brother, I would play doctor with him. I just found the human body just so interesting. And I wanted to be in medicine, in healing, and focused on that right from the get-go in my life. I like biology, I was good in science, and it just all made sense. And so when I was 16, I got my braces off, and my orthodontist offered me a job in his office. And just filing. I was the file girl. I had to get everybody's ortho records out and file them back. So I'm really good at the alphabet. And I watched the hygienists in the office, Suzanne and Susan, the two hygienists that worked with him. And I thought, oh, this is healthcare. I can do this. That doesn't look hard. And there were no nights and no weekends. And little did I know, but I was thinking there was no blood and no urine. And, so because I didn't really want to be a nurse. And so I looked at dental hygiene. I thought, oh, it's healing, it's healthcare. And I could be a mom. I can do this part-time. I can make this work. And then I got to hygiene school and I was like, oh, this is way harder than I thought it was going to be. So that was the beginning of my journey. And I didn't think I would stay in clinical hygiene. I wanted to be a researcher, or I wanted to teach. So I do have a bachelor's in dental auxiliary teacher education from Chapel Hill. And then I did my student teaching, and I realized I don't know anything about being a hygienist. I can't teach this until I practice it. And so I decided, all right, I'm going to be a hygienist. And I worked full-time in an office in Florida. So everybody I was 22 and everybody was 108 years old. They all left their toothbrush in New York and moved to Florida. And it was a hard year for me. I saw 10 patients a day, 50 patients a week. By Friday, I hated dental hygiene. And I was like, this is the worst job ever. I am the cleaning lady. I am not a healer. I am not doing the things that I went into hygiene to do. And so I left dental hygiene after 1 year. It's like, I'm not going to do this for the next 20 years. And I moved from Florida to Maine. I have a master's in business. I was trying to get as far away from healthcare. It's like, the office that I was in was a leading edge office. He did full mouth reconstruction. He did implants before implants were even a thing. And he did beautiful work. But I didn't feel valued. I was a cleaning machine. And that was so disappointing, because the people would come back 6 months later and they still have the same stuff that I took off 6 months earlier. And I didn't have, I had 45 minutes a patient. What are you going to do in 45 minutes? And so I left that. I was like, if this is the best that dentistry can offer, then I have picked the wrong profession. And so while I was in grad school, I did dental sales, and I walked into a dental office that had a phase contrast microscope. And I looked at that and I said, tell me about that. huh, now I can see a way forward to be a healer. Because once I can see the bacteria and what's going on in that pocket, now I have a tool that I am not just scraping teeth, polishing teeth, and getting on that treadmill of disease and just watching disease get worse. Now I have a tool to go forward. And I asked that dental office if I could have a job there. And they gave me a job there. And it changed my world. And I came back to dental hygiene, and I love it. I absolutely love my profession. I am a healer, and I'm a coach and a cheerleader, and I have been a dental hygienist for 46 years. And had I not walked into that dental office with the microscope, I I would be doing something else. So that microscope brought me back to dental hygiene, and then from there, I have, I learned about airway and sleep and the systemic connection and heart attack and stroke and how our pathogens travel. And, we talk about bacteremia in school, but then as soon as we graduate, we never talk about it again. And so
True. Yeah.
and so how do we do a better job? And so from there, I learned about ozone, and from there, I learned about biological hygiene. I had no idea this was a real thing. And with biological hygiene, I'm looking at the root causes. Why do we build up calculus? It's not that we're, bad brushers. It is body chemistry. It's minerals, it's nutrients, it's airway, it's sleep. And that's where biological hygiene has just changed my world and, brought it all together. And I'm still learning, even 46 years into this career, it's like, wow, why didn't I know this? And why aren't we talking about this? And, and I still take plaque samples on every patient. I have my own microscope because it is that important to me. And I do plaque samples, and I do volunteer work at schools, and I show the kids, this is what's going on underneath your gums. And the patients get it. And they always ask me, are we going to take a plaque sample today? It's like, absolutely. That's why you're there, because I want to reward them, because I want them to see that the work that they're doing in nasal breathing and in nasal hygiene and in better oral hygiene and in systemic health, all matters. It all comes together on that microscope slide. When I look at a slide that's dysbiotic, I'm talking with the patient about, what's happening in the body that is allowing your immune system to allow this dysbiosis that's showing up in the mouth. The mouth is just a symptom. We're treating it like the whole disease, but it is just a symptom of greater systemic issues. It is just a little red alert that, hey, something's going on deeper. Is it nutrition? Is it absorption? Is it systemic illness? Is it mouth breathing? Those are where we need to really focus. So that's, I can never go back to just scraping and polishing. And I want to inspire all of my hygiene friends to really, let's ask better questions. Why is there calculus? Why is there decay? What is happening within the body? Where are the minerals coming out of the teeth? Why? You have to ask why. And so that's been my big question. Why is this happening? And we have to change our focus from just removing calculus and spending all of our time scraping the heck out of teeth and look deeper. So there you go.
That is so awesome. What kind of microscope? Oh, I have so many questions.
Good.
Is there regular? I say regular. What kind of microscope do you use to do
So
this?
I own an Olympus. It's a phase contrast microscope. And then at the office we have a Zeiss. And so it is, it's a big tool. It's a regular microscope. It's a clinical grade, and it is But my microscope is probably 30 years old. It still works beautifully. And I take it to schools. I take it, to our course. I cart that thing all over the place. And we have our microscope at work in the hallway, so that we all share it, and we take plaque samples, all the two other hygienists and the dentist, and we're sharing that with the patient on every appointment. So
How does a person learn how to be a biological hygienist? Like, is that a degree? Is that a certification? Is there a school? How do people know how to do this?
Well, that's a great question, Kelly. So I am a member of the International Academy of Oral Medicine and Toxicology, which, I didn't even know it was a thing. There's also the International Academy of Biological Dentistry and Medicine. The IABDM and the IAOMT are sister organizations. We focus on, the deeper issues. So both organizations have an accreditation program. So it opens the door to learning more. And we meet, I will be going to San Antonio next week for the IAOMT meeting. And then at the IOMT meeting, I offer a 4-hour course on kind of fundamentals of biological hygiene. What do we do on Monday morning that's different than what we did on Friday? So more testing, and how to use the microscope. And then my bio besties and I, Fran Horning, Catherine Gilliam, and I have put together what we call Boost Oral Health Institute. And BOOST stands for Biological Options for Oral Systemic Therapies. So we will have a BOOST course in June in Denver. And it's a 2-day hands-on, again, taking the microscope and really looking at our own pathogens. And then what other testing, what other tools. And then we'll also be doing a BOOST course in New Jersey in October. So those are the best ways that I have to educate and train my fellow professionals.
Wow.
Yeah.
That is so amazing. So do you teach in this course what the startup costs are for this? Because I'm sure that is what the startup cost is to invest in this for yourself. Like, what do you need to get started? How do you have those conversations with the patient? How
Yeah.
do you educate doctors where you're working on how they're supporting you or in the conversation? But obviously it's got to be adopted with the entire practice
It
too. You
does.
can't just like go rogue.
Yeah. I know. I mean, I went rogue, and I would bring my microscope into these offices that I was temping in, trying to encourage and interest them. And some people are interested, and a lot of people are just happy to scale and polish. So, it's what are your goals as a hygienist? Do you want to be a healer, or do you just want to go in and buff and go? I wanted to do more than buff and go. And so that's where, my curiosity and my passions have really sent me down that rabbit hole. And so, for those that want to be curious and learn more and to be a healer, we as a profession, I'm so excited because we are at the cusp of growing our profession. We have done the same thing for 100 years, scale and polish, scale and polish. But really, I look at us as the center of a spoke of a healer, because I can see problems. If I've got somebody with tooth decay and they're a midlife lady, I want them to go get their hormones checked, because your body's taking these minerals from your teeth and using them elsewhere. And so, that's the beginning of osteopenia when I see that, or sensitivity, because, a midlife lady that has sensitive teeth, that tells me that, again, estrogen is out of whack and we're losing minerals and the enamel's getting thinner. And so it's foreshadowing. So I want blood work. I want labs. I want sleep study. I want to know if you're clenching and grinding. So I feel like we as a profession are the center of that spoke of the wheel. and we can help guide our patients to way deeper, better healthcare. My goal is to age with grace and to be healthy and not have chronic disease. And so that's where I look at dental hygiene as the most important healthcare provider in the whole healthcare system, because we have that view of how do we prevent chronic disease and help our patients to really be healthy. And so that's why I love dental hygiene, and I'm so passionate about this. So startup costs, you asked me about that. I got sidetracked. Sorry. A phase contrast microscope really is $6,000 to $10,000. It is not that, everything else, lasers are 20,000, air polishers 20,000, but a microscope, $6,000 to $10,000. And you have to make a commitment to take a slide on every patient. So it is the first thing I do, as I'm doing my oral cancer screening, because I do that on every patient. Absolutely. Testing is the most important thing, because if we're not testing, then we're only guessing. And I'm not a guesser. I am a healer. So I'm taking a plaque sample from 4 different pockets. I'm going to look at the perio chart. I'm going in the depth of the pockets, and I'm getting the plaque at the base of that pocket. Put it on a microscope, put it off to the side. Then I finish my oral cancer screening. I use disclosing solution on every patient. And my disclosing solution is tricolor. So new plaque is pink. Old plaque is purple, so it's been there for at least 2 days. And then acidic plaque is baby blue. And so that's when I do my patient education. I've got the Optrogate in there so that the patient can see what's going on their teeth and how good they're doing oral health wise. And then I use my air polisher. My air polisher has ozone water in it. So ozone gas kills bacteria, fungi, parasites, viruses. Boom. 3-second kill. So I've got, if I have somebody with a lot of bleeding gums, I'm putting ozone gas in there first. If they're, a healthy recare patient, I've got ozone water. So as I'm using my EMS system, I am disinfecting, because I know what's in those pockets, and I don't want to introduce that bacteria, the fungi, the viruses into the bloodstream, because we cause bacteremias. And then, I've got research on that. And those bacteria, we have found them in the brains of 90 to 95% of dementia patients. So as a healthcare provider, I do not want to contribute to dementia. I want my patients' biofilms to be healthy biofilms. And, spirochetes, and I can see spirochetes on my microscope slide. Spirochetes and best friend, his best friends are Fusobacteria nucleatum and also Porphyromonas gingivalis. They are the bad best buddies. And they have found, the Porphyromonas gingivalis in the brain of 95% of dementia patients. So
that's crazy. I mean, that is becoming more and more prevalent in the research. When I first came out, I'm like, of course it's there.
Yeah. And it's creating the same biofilm in our brains as it is in our mouth. And you know how hard it is to get that biofilm off. If you use an EMS system, I am taking off layer by layer by layer. And I can see it go from pink to purple to blue. And it takes me, for my teenage boy patients that never brush, sometimes it takes me an hour just to biofilm, get that off. And if that's in the brain, how are we have to prevent that. And so it is, that's my driving passion. I've had a family member with dementia, and it is going to triple in 25 years. And it is a horrible, horrible disease. Horrible. And it is, but it's 90% lifestyle. So it is up to us as as a valued member of our healthcare profession to really jump on this and say, you have to do a better job at home, because I can clean your teeth 2 or 4 times a year. Clean them. I hate to say that, but I mean, that's what we're doing. But within 24 hours, that biofilm is way right back. Bill Costerton, the father of biofilm, showed it returns in 24 hours. So it is, what are we going to do differently on a daily basis?
Is there any research? Because as you brought him up, I was thinking about the old acquired pellicle. Is
Yeah.
there anything that we can do to prevent or slow down the redevelopment of the acquired pellicle?
Well, I mean, the pellicle has a job to do. So we need the pellicle. But when it turns dysbiotic, that's the thing that we have to address. The pellicle protects the tooth, it remineralizes the tooth, it buffers the acids. So it's supposed to be there. But when it becomes dysbiotic, when we are mouth breathing, when the pH drops, so many, I mean, every kiddo out there has got their head open, their mouth open, and their head down, and they're looking at their phone. Yeah, exactly. And so, that's where, teaching our kids to use their nose, doing nasal hygiene for me is more important than oral hygiene, because if we have saliva, if we have a good flow of saliva, then we have a healthy biofilm. And that's the key. So many kids are mouth breathing. They're open mouth chewing where they've got malocclusion. That's improper
Yeah.
breathing and
And,
improper oxygen.
teaching,
So
absolutely.
yeah.
And so one of the things that I love talking about too is the impact of malocclusion on everything and how it contributes to periodontal recession. And all of these different things are working together and they're telling you a story. So, Barbara, when you are discovering this with your patient and you're discovering it, let's just say that you weren't finding anything that was like really interesting 6 months ago, but all of a
Mhm.
sudden something's changed. Are you do you have people in your referral network in your practice that you're referring to or making recommendation? What is your recommendation to that patient sound like?
Absolutely. So I am blessed to work in a biological office, and it is airway focused. And so that's when, okay, we need a sleep study. What has changed? How are you sleeping? And those are really important questions, because we have to sleep like our life depends on it, because that it does. That's when we clear the brain. That's when we oxygenate. That's when we grow. That's when we heal our body. So if we're not sleeping well, then nothing else downstream matters. If we're mouth breathing, we're always going to have perio and caries. So those, if you're mouth breathing for 6 hours or 8 hours a day while you're sleeping, we got to fix that. And you're not rested, you're not healthy. That's the beginning of chronic disease. Again, back to chronic disease. So that's where a sleep study. That's where I look at their tonsils. I grade their tonsils. I'm looking at their tongue. I'm looking at their Friedman score, because I want to know where that tongue sits. And if this tongue is blocking the airway, again, we need night lays. Let's reduce that swelling in the palate. Let's train you, with myofunctional therapy so that you're breathing through your nose. So your tongue is where it's supposed to sit, so that you grow your face properly. So having those resources in the office is a game changer. If you don't, you've got to work with somebody who is airway focused and find myofunctional therapists in your community. So much myofunctional therapy now is even done online. So it doesn't have to be a local myofunctional therapist. But, working with those providers is a game changer. It's not about scaling and polishing. It is about proper function. It is a proper, the whole body needs to work together.
Yeah, it's no different than when you go to the orthopedic doctor when you have sprained something. It's like, okay, something's out of whack. Let's get everything healed so it can function together. I just, that was a very simple analogy. But Barbara, I also talk to a lot of hygienists and coach a lot of teams. And, our burnout rate is so high. And I just want them, just like you and your beginning story, when you said I got out of hygiene because you were like, this is it. And that's not what you felt in your heart when you entered, right? But it was through
Correct.
opening your eyes, through learning, through putting yourself in a different position that you realized, now that is it. That is it. So I believe that learning more about what is possible for us as a profession, as a human, as a healer is
Mhm.
the ticket. So I am just, this is amazing because it think about how much it lights us up to be able to come into work at every day, to know that we're making a difference with the testing because, there's saliva testing, there's all different types, but there's a turnaround time. It's not chair side. And
Yeah,
it's so difficult to know
yeah,
that
exactly.
information to be able to treat that same day to say, okay, how do I treat you right now? Because you're already in my chair. How do I treat this and make a recommendation?
Yeah, absolutely. That you're right. The salivary diagnostics take 2 weeks to come back. By then the patient's gone. They don't care because it's just a piece of paper. It doesn't mean anything. Whereas when you see that amoeba oozing across the screen, that's a game changer. When you see those spirochetes attacking, when you see a trichomonad, trichomonads look like microscopic mice, and they are inquisitive and they're like a Hoover vacuum cleaner going across the screen. It changes the conversation from, oh, I need to brush better, to, oh, what is going on in my body that is allowing this? What do I need to do today? And I want you to see my husband and I want you to see my kids. And it is the biggest office, I mean, it's internal marketing. Patients get it. And I don't understand why dentists don't get it, why there's reluctance to add, yeah, it's one more thing, but it takes me 3 minutes to really put that microscope slide up there, tell the patient what to expect in a healthy mouth and how that differs from disease. And once you see that undulating mass of, pathogens, then the conversation shifts and they're ready to, if I told them to stand in the corner and spit wooden nickels, because that would make those pathogens go away, they would do it. They are enrolled. And so I can guide them. And if it's still there the next time, because I tell them, okay, I want you to do this. I want to see you in 2 weeks. We're going to do a microscope slide. That's all. I want to see a change. I want to see the bleeding's gone. I want to see the healing's happened. And if it's not better, then we're working up the totem pole. Then we're talking, nutrients and gut health and blood work. We're medical offices. Why aren't we asking for blood work? I need to
A
know
hundred
vitamin D.
percent, 100%.
Yeah,
Yes.
we
The
are
whole,
we
yes.
we are medical. We should be taking blood pressure. We should take pulse ox. I want to know your blood oxygen level. I want to know, your vitamin D level, your C level, your magnesium, your thyroid, your hormones. Are you absorbing your nutrients? And is there, celiac? Is there irritable bowel syndrome? Is there, we are medical. And instead we're just treated like the cleaning lady. You're getting a cleaning. And
Yeah.
so,
There's so much more. There's so
yeah,
much more.
there
It,
is.
yeah. And you have gone in the room and flipped the light switch on. This is amazing. And I want to have you back. I have more questions for you.
Good.
Tell us about when your courses are. June when?
Uh, June, the Friday and Saturday in June. I want to say 26th and 27th. And then in October, and I would have to look up those dates. That will be in Fairfield, New Jersey on a Saturday and a Sunday. So if you can give me a second, I can look that up real quick.
I'll say we can also drop it in the show notes as well if you,
Yeah.
but you can look that up. While she is doing that, you guys, this is what it's about. Like, reinvigorate yourself. Remember why you fell in love with why you chose this profession. No matter what seat you're sitting in the practice, this is where it's at. It's rediscovering you.
Yeah.
Barbara, did you look at the date? Did you find it?
Yeah. It is 24th and 25th, so a Saturday and a Sunday in New Jersey, Fairfield, New Jersey. It is a training center, so we have chairs, and we have a great big room, and it is awesome. It is awesome. Yeah, dental hygiene. Yes, what I do takes more time. I have 90 minutes a patient. I see 5 patients a day. So my body is happier, my neck is healthier, my back is healthier, and my patients are healthier because I have the time to educate. We are educators more than anything else. We are prevention specialists, and we have to have the time to educate our patients. And so, yes, insurance can be an issue, but we don't take insurance in our office because my doctor values the preventive education that we give our patients. And that's what it takes is time. You can't just throw a toothbrush at a patient. You have to put the toothbrush in their hand. You have to give them time to learn. And you have to do the testing.
Yeah. So next time we'll talk about, Barbara, we'll talk about how we change the paradigm of hygiene. How do we become the change agent for in the profession? How we already are that change agent.
Yeah.
We already are that.
We just have
and
to
how you live it out loud. How you live it out loud, right?
Yeah.
So I'm going to have you back. Our time is up for today. It flew by, you guys. Barbara, thank you so much for coming on the show today.
My pleasure.
Thank you so much for all that you're doing. You guys, if you want more information on Barbara, her information is in the show notes. We're going to have her back on, and what a delight. I have so many more questions, but for all of you all watching today, thank you so much for the lives that you touch. I always ask the favor from you to go on to Apple Podcast and to give the Dental Handoff a 5-star rating. Please go ahead and do it now, because Apple's the one that matters. And if you're watching this on YouTube, please be kind and do subscribe to the Dental Handoff channel so you're notified when we drop an episode. And then in the comment section, write a love note to Barbara and tell her how much you love her, because that makes the algorithm, it's going to show her love, and the algorithm is going to love on us and suggest it to more people who could benefit from this. So we will see you next week, my friends, and be well. And thank you for all that you do. We'll see you next time. Thanks again, Barbara.